So you're looking for some ways to improve your health naturally. The title of the video, How Can I Improve My Health Naturally, suggests that. And so maybe you have some chronic health issues that you've been dealing with for a long time. Maybe you're new to kind of realizing that maybe you do have some health issues and you want to try some natural things to get your health improved. So in this video, I'm going to take you through some things to be thinking about as you're approaching this, whether you're working with a healthcare provider or trying to do this on your own, doing some diet changes, taking some supplements, etc. There's some critical things that you want to be thinking about as you're making these choices. And I laid them out there. If you can't read them, number one is curious, number two is tracking, number three is model, and number four is repeat, rinse and repeat. So that's what we're going to be talking about in this video. My name is Dr. Nella, and myself and Dr. Klein do this type of thing in our practice at Southwest Integrative Medicine, where we're always trying to find the least invasive, most natural thing to do to get your body healthier, to get you in the best health possible. And these are the types of things as a overview of what we do when we're doing this. So you want to know how you can improve your health naturally. The first thing I would say is, number one is you need to get really curious about what is going on with your body. Now, you may not have all the information. You're probably not a doctor, but you do have some information. You have direct access to your symptoms, when they come on, what types of settings occur when they come on. Do they come on in the morning? Do they come on in the afternoon? Do they come on at work, at home? All these things are helping build the picture or the model of what's actually happening. Now, there's different areas of our body that could be affecting these symptoms, and I would recommend that you don't just go based off of if you have a doctor and they're kind of taking you through these steps, then definitely want to follow their advice. But I'm just saying, if there's a diagnosis there that's been long-standing for many, many years and you're not getting anywhere, that's a good opportunity to revisit, what the actual problem is, especially for like junk diagnosis, like IBS or chronic fatigue syndrome, where they're just not known like what the actual issue is, or fibromyalgia. The underlying mechanism isn't defined, and so you might get thrown a medication for, try this, try that, and then you're sort of stuck with, nothing's working. I've been trying different medications and nothing's working. So where do you start? Like I'm saying, you need to get really curious about what's actually happening inside your body to create these symptoms. What scenarios bring them on? And you may not have all these answers, but you need to start asking questions to yourself or even your healthcare providers to help you start building the picture, the mental model of what's going on. This is not only going to help your practitioners figure this out and help you, but it's also going to help you help yourself. So the other thing that comes to mind when thinking about how people can improve their health naturally is to you need to get really granular or really specific about tracking the things that you try, so that you know what the outcome is. So you may a friend may recommend, oh, I tried this and it helped my digestive symptoms. I tried probiotics, or everyone thinks probiotics. Let me try those. So that's fairly straightforward. You just go pick some up and try it, right? Well, it turns out there's different strains of microbes that you could be taking. There's different things in probiotics that could be affecting you one way or another. Sometimes they'll throw digestive enzymes. Sometimes they'll throw prebiotics in there. Sometimes they won't have either. So tracking the progress. And so you may try a probiotic and you get worse, or you try one and you feel better. Well, you want to look at what's in that and track your progress. What actually does get better? Do you have less gas and bloating? Do you feel more energetic? Do you have less joint pain? What is the actual symptoms that are improving? Or is it just a general well-being? Is it your stool consistency. What are the symptoms that are actually improving? How long does it take to improve? What are your expectations when you take the probiotic? Do you expect it to improve in 1 day, 2 days, a week? How long do you need to take it? These are all the things that a doctor would be advising you on if you were seeing them. But working through this stuff on your own, you need to ask these questions and then actually get granular about tracking the details so that you remember. Don't try that one again next time. Let's try one that looks a little different, or find out why perhaps. These are all questions you can ask your provider. Why didn't it work? But when you're working with somebody that is curious about what's going on, they'll be able to point you in some general direction as to why some of these things are happening. Not all the questions, we don't know all the answers to all these questions. There's, lots of unknown things about human health, even though we've made so many changes and improvements over the years. There's still a lot of unknown things. And so by you tracking your progress, and seeing what does and doesn't work, you're actually helping yourself, and you can bring those questions to your doctor if you have one, and they'll hopefully be able to kind of shed some light on why those are happening and further enhance the model of what's going on in your body to create those symptoms, which is going to bring you closer and closer to the cure. And so that's sort of the next thing is, you're always sort of refining your model for what is and isn't going on. You have a positive result from something, that's going to give you information on what's going on in your body. Why did that have the positive result? Why did the probiotics have the positive result? Well, simple answer would be maybe you're lacking gut flora, or maybe you have leaky gut syndrome, and that helped that a little bit, or maybe you have some pathogenic microbes in there, and this is sort of crowding them out. So there's lots of different scenarios for each supplement or vitamin or nutrient or even diet change that you might make that could have a positive or negative effect. And you should be testing these things and then verifying that with your model. Does it fit? Does it not fit? If it does, great. You should be making progress towards better health as you move along. And then the next thing, and how to improve your health naturally is you're always refining it. So you go back to step one, get more curious. If it didn't work, why didn't it work? And further refining your model until you feel like, there's really nothing more that needs to happen as far as your health. Sometimes these things are really simple. You can see in labs, the symptoms, everything matches up, boom, the person's better. It's with the chronic health issues that you need to take a kind of a broader perspective and look at all the things that are going on. Usually that happens as you get older too. There's more health issues that come up, and they need to be sort of fit into a model. You need to track a lot of symptoms, track a lot of lab values to further and further refine your model. But yeah, just wanted to give this video on what you can do to improve your health naturally on your own in conjunction with your doctor, and be more involved in your healthcare. I'm a big advocate for my patients to, kind of track what their symptoms are and track what their progress is. And I'm always tracking along with them to make sure we're on the right track. And when we're not, go back and try and find out why we're not on the right track. Okay, so then lastly, I just wanted to mention there's a lot of information out there on what you should and shouldn't be doing for your health. So pick, one or two people, preferably a doctor or somebody that is very reputable, to help guide you along the way of improving your health. If you're following too many different things, you're going to get overwhelmed and confused. And then also use your own symptoms, use your own body as a guide to what is and isn't working, and again, track your progress. So that's all I had for you in this video. Hopefully, this information was helpful in helping you understand, how you can improve your health naturally. These are sort of foundational type things that I think people should use as tools to help themselves get healthier. And this is sort of the framework that we use in our practice to sort of track people's progress and help them find out what the actual cause is to their health issues. So if you like this type of information, please hit the like button. We will be posting more videos on similar type of information, natural health things, hormones, digestive problems, things like this in the future. So please subscribe to the channel if you want to get notified when the next video is posted. And we'll see you next time.